I'm really excited to be here to be able to talk to you about a topic that I'm absolutely passionate about, and that is self care. And I love the title of self care as medicine because, as I'll talk to you about in a little bit, that's not the way a lot of the world sees self care. But I certainly do. So let me begin with some disclosures. Funded by the NIH to study self care. I developed a lot of instruments to measure self care, but I give them away for free. So I don't have any conflicts of interest to report to you. So the focus of what I'm going to talk with you about is really chronic disease. This is the great health challenge of our time. I think you probably already know that. Um, so I was educated as a nurse, and I think I was particularly disappointed, I'll say, to when I actually saw this data on most care for chronic illness being performed by patients and their families. I sort of naively thought that I was important in this process and that we were doing most of the care for chronic illness, but 99% of the care of chronic illness is performed by the patients. And so self care is incredibly important for people with a chronic illness. So this slide addresses the importance of self care for a lot of different conditions and different situations other than chronic illness. It's particularly important for people with a chronic illness, but you'll see from the top here that it's really important for daily choices, lifestyle, minor ailments, acute conditions, major trauma, all these different things that are really important in self care, or for self care is really important for all these different conditions. So let me really sort of settle in with a definition of what I'm talking about in terms of self care. We define it as a process of maintaining health through health promoting practices and managing illness, managing symptoms also when they occur. So I like to look at self care as this umbrella concept that self care is really the major term, but there are all these different behaviors that go into this process of self-care. And I'm going to talk with you about self-care maintenance, self-care monitoring, and self-care management. So in terms of definitions, so maintenance is the behaviors that people use when they have a chronic illness to keep themselves stable physically, emotionally. So it encompasses a lot of the treatment adherence kinds of things that we do. But it's really all those healthy behaviors. And we're going to talk about some of those. Self-care monitoring is a process of observing oneself for changes in signs and symptoms. This sounds pretty simple and straightforward, but I'm going to hopefully convince you that it's a lot more interesting and complex than you might think on first view. The third major concept is self-care management, which is that response to signs and symptoms when they occur. And this involves, shown up here in the green, symptom recognition, symptom evaluation, treatment implementation, and treatment evaluation. And buried in here is this decision-making process that we're going to talk about in a little bit. So let me start by talking about some specific self-care behaviors. And these self-care maintenance behaviors that I already defined as including treatment adherence and healthy behaviors. This list could be really long, but some of the big ones that we talk a lot about have to do with a healthy diet, exercise, sleep, medication taking behavior, tobacco avoidance, and stress management. I want to say some things about a few of these items. I'm not going to go through all of them, but some of them are perhaps more powerful than others. And I want to say something about each of those. But I want to start with the marketing industry. So I bet you've seen some of these kinds of graphics on magazine covers, on the internet. When if you searched on self care, this is the kind of thing that you would get. Um, I would argue to you that this is really not stress reduction so much as it is sort of self soothing. So the marketing industry has really pushed self care to the general public. And if you look at some of the data from the marketing industry, there has been like a tenfold increase in internet searches, purchases related to self care products, whether it's bubble baths or medication. Meditation apps, all of these different strategies for self care, which I think is really self soothing. I'm not bemoaning stress reduction because I think stress reduction questions are great. But let's start with this first polling question. How has the marketing industry influenced your view of self care? I'd love it if you'd put some of your thoughts into the chat.
Great. Please add your comments in the chat. Judy says, need to go on a cruise for self-care or go to an island. Purchases related to diet, Tina said. Lisa says, it's influenced me a lot. It just seems some that way. Jill says, I've thought more about what you described as self-soothing, such as a massage.
I love. I'm not bad mouthing massages and self-soothing behaviors that are great. I love a good bubble bath, but that's not what I'm talking about with self-care.
Somebody else, a few more comments. Somebody says it makes it sound expensive and unattainable.
Yeah.
Angelietta says that self-care looks like products to be purchased or looks a certain way when spending is involved.
Yeah, products to be purchased. I think that's really sort of the key point. It's so interesting that when I started in this area, studying self-care, maybe 30 years ago, it was not in the public domain. And then in maybe the last 10 to 15 years, the marketing industry has just taken off with it. Anything else, Vanessa?
Yeah, a couple of folks said it hasn't influenced me much. I don't watch TV. One of my self-care non-activities is not watching TV. I attend the gym, eat vegetarian, read poetry, and walk and smell the flowers. Somebody else said not much or no influence. I rarely do anything. I'm always working, sadly.
Oh.
Another person says, I'm not market influenced, but research for self-care tools based on personal experience. And then just a couple more, promoting something to buy rather than something to do for yourself.
Okay, well, let's go on a little bit and let's talk about real self-care maintenance, which is stress reduction. So there are lots of benefits for stress reduction. Here I'm talking about meditation, exercise, not the self-soothing behaviors, but the true stress reduction kinds of behaviors that are very powerful in terms of benefits of stress reduction. We know that people who really engage in stress reduction behaviors, reduction in stress hormones, changes in inflammatory markers, immunity for acute and cancer cells, gut microbiome, sleep quality. lots of different real benefits of true stress reduction that we don't get with the self-soothing kinds of behaviors. So if I had my druthers, I would get the marketing industry to stop promoting the self-soothing behaviors, because that's not really what I mean by self-care.
We had
I
one.
want
We had one more question about that
Please.
relates to that slide. It said if a massage is self-soothing and not self-care, how is if a massage helps us manage stress and stress is dominant in causal relationship to disease, doesn't stress management count as self-care? Which I think you just covered. But do you want to say anything else
Yeah.
about that?
Yeah, I mean, if you can do something, I think the key here that I'm trying to get across is that the regular use of stress reduction techniques, and if you can afford to get a massage every day or every couple of days or 3 times a week, that would be absolutely great. But there are a lot of other stress reduction techniques that we can use that will give you the consistency that will give you these benefits of stress reduction. So it's the consistency factor in here. Another self-care maintenance behavior that I want to talk about is exercise. There are a lot of different kinds of exercise. This is not just the get 10,000 steps a day kind of thing, but the aerobic exercise, strength training, flexibility, and balance kinds of exercise. If you look through this list of benefits on exercise, I think you'll see every benefit that you would have hoped to have seen or that you might be looking for. If you're trying to strengthen heart and improve circulation, decrease your risk of some of these chronic conditions, decrease your risk for osteoporosis, manage your weight, improve your sleep, boost your mood, improve cognitive function, the data on cognitive function and exercise is really very interesting. We're understanding a lot more about the benefits of exercise on Alzheimer's disease. It's not so much the tau tangles and amyloid. It's a lot of it seems to be cerebral circulation. So there are many, many benefits to exercise. And if anything, if I were to pick out one self-care maintenance behavior out of this entire list, I would probably go for exercise. Incredibly powerful self-care maintenance behavior.
Just wanted to call out one of the comments. I'm using an under desk bike as I watch this webinar.
That's great. Okay, and then the third, or actually the fourth, if we that we talk about self-care maintenance behavior, the importance of sleep. This is another one of those factors that I am old enough from the era that I can really understand and remember the times when people would say, like, well, I'm going to give up sleep so that I can exercise or, do X, Y, and Z. And that is really the wrong approach to self-care, because sleep is more and more recognized as incredibly important to our well-being. In older adults in particular, let me get rid of my phone since I have it on airplane mode and someone is uh, is texting me. Excuse me. So in older adults in particular, chronic sleep disturbances are seem to be related to the risk of Alzheimer's and cardiovascular and cerebral health. Very, very important. And there are elements of sleep fragmentation, delayed onset, insufficient total sleep time that are really contributing to the negative effects of poor sleep quality, as sort of a generic term that we're seeing. But there are a lot of risk factors for poor sleep quality that are related to age and chronic illness. So I want to go through some of these because they're particularly important. There are some chronic illnesses that are directly related to poor sleep quality. heart failure, diabetes, etc. You can read the list, sleep disordered breathing. There are other conditions that are related to sleep fragmentation. Aging is one, body weight, poor exercise patterns, and stress. So here we are linking sleep quality back into some of the other self-care maintenance behaviors that we've already talked about. And sadly, some of the drug effects that are the drugs that we actually give for the chronic conditions can cause the side effects of poor sleep quality, especially polypharmacy um, uh, being a factor that interferes with sleep. Such an important self-care maintenance behavior. Okay. So if I were to choose, what could I do as the most important self-care maintenance behaviors that I could engage in? I would choose exercise and sleep. And of course, medication adherence is incredibly important. The thing that's difficult about this list, though, is that if you ask people what they can do, they'll say to you, I can take my medications regularly, that I can handle that one. But exercise is very important, very difficult for people to engage in for some reason. And sleep is also very important and difficult for people to deal with some of the issues of sleep. But I think if I were to take one thing off of this list, it would be exercise. And that would be the thing that I would focus on. Okay, I'm going to go into this next element of self-care, which is self-care monitoring. The monitoring and tracking of behavior and symptoms involving these processes of body listening, symptom detection, and symptom interpretation. Now, I have to admit to you that my husband actually teases me a lot that I'm not good at body listening because I can tend to focus on whatever it is that I'm doing and ignore if I'm cold, I'm hot, I'm whatever. And so I tell you this to say that it's a behavior that doesn't come innately to some of us anyway, and it's something that we really need to concentrate on is body listening. So what we're looking for are symptoms, which by definition, this is a feeling or an experience reported by a patient. It's not something that I can tell you that you're having. The person is having it themselves, involving the physical or emotional experience, the cognitive experience of what you're thinking about that particular experience, and the affective experience or the emotional response to whatever it is that you're having. So the symptom experience is multidimensional, which probably makes it a bit more challenging to really focus on. So I became really interested in this because I do a lot of work in heart failure. And so I had this experience of dealing with heart failure patients who would come into the emergency department and they would have gained like 20 pounds of water weight in their ankles. And they would say, I never noticed it. And so, yeah, in one of our studies, we asked people with heart failure in the last month, did you have this symptom? And if you did, how quickly did you recognize it as a symptom of heart failure? And if you look down this list, in particular, I'll just point out one of them here, shortness of breath, where 93% of our sample said, yes, I had that in the last month, but only 59% of them said, when I had it, I recognized it as a symptom of heart failure. And so I then worked with some of my physiology colleagues to understand this phenomenon and learned from them that it was really this issue of interoception. So a lot of us were educated at a time when we focused on fewer than 8 senses: vision, auditory, taste, olfactory, tactile senses. But now there's the inclusion of vestibular, proprioception, and interoception. And I'm very interested in interoception, which refers to the set of processes through which an organism senses, interprets, integrates, and regulates signals from within the body. So this is I feel hungry, I feel thirsty, and I feel a symptom. So this particular sense plays an important role in the ability of people to perceive and respond to their symptoms. So one question that I've asked over the last decade is, why is symptoms recognition so poor, in particular in heart failure? But we now recognize that on magnetic resonance imaging, on MRI, people with diabetes, cancer, heart failure, and chronic pulmonary disease have less insular gray matter, and abnormal insular activity compared to healthy people. And it's the insular cortex that is in the brain that is responsible for interoception. And so people who have problems with the insular cortex and insular activity may have poor symptom perception. So this is an active area of research that's ongoing about what other conditions are actually demonstrating an issue with the insular cortex. Okay, so let me go on to talking about self-care management. The last of the 3 behaviors. This is the response to symptoms. So self-care maintenance, I'm performing healthy behaviors. Self-care monitoring, I'm tracking, I'm paying attention to the symptoms that I might have. But then when I have them, the reason I'm tracking them is so that I can do something about it. And that's self-care management. Ideally, when someone performs a behavior in response to a symptom, we hope that they will go back and evaluate that behavior to figure out whether or not it worked, and are they going to do it again. So there are a lot of contributors to poor symptom response. People who live alone might be poor in responding to their symptoms because people who live with family members might notice their symptoms earlier, because the family members might say, honey, you're short of breath, or you seem like you're frowning, what's going on, that kind of thing. Lack of experience is another factor related to poor symptom response. People who have better functional class, like they're not symptomatic, have a poor symptom response just from lack of experience. People who've never been in the hospital often have a poor symptom response because it's lack of experience. Aging with comorbid conditions, I don't know if it's my lung disease or my heart failure, overlapping symptoms. And then people who lack knowledge and have misconceptions about their symptoms oftentimes do not respond well to their symptoms. So this is just a list. I'm sure there are other factors that are related to a poor symptom response. So what can we do with patients, and what can what kind of teaching can we do to help our patients be better at symptom response? A lot of patient teaching involves the teaching of tactical skills. We tell people how to read food labels, how to assess their symptoms, how to manage their medication regimen, even how to talk to the doctor. But it's the situational skills that we're not good at teaching to patients. What to do when? If we say to a patient, I want you to follow a low sodium diet for your hypertension, what do they do when they're dining in a restaurant? What do you do when you go on vacation? What do you do when a medication is forgotten? It's these situational skills that are really important for the symptom response knowledge in the self-care management. So I want to kind of switch from here and talk about how good is self-care.
We had, Barbara, do you want to take a couple questions? We just have
Sure, happy to.
one person asked, how often do you recommend exercise and movement? And then another person asked, what is NYHA?
I'm sorry. Oh, I should have. Yes. Let me do that second one first. New York Heart Association is a measure of functional class, and it's really a measure of can you do stuff without getting symptoms. That's really what it measures. Thank you for asking. And I hate abbreviations. I can't believe I did it. Okay, forgive me. All right, so how often to exercise? I can tell you that about 15 years ago, I heard a great presentation on exercise and cognition, and I exercise almost every day since that, because what we're understanding now about exercise is that cognition is a function of cerebral perfusion. And so if we are perfusing the brain, we're going to think better. Oh, that got me. I was totally into it. Came home, said to my husband, we're doing this. And so we both exercise almost every day. I can't say every day. Some days I do yoga instead, but I really try to do exercise every day. I don't do an hour of exercise every day. I might do 20 minutes on a treadmill, but I think consistency is really important. If I didn't answer that as fully as you wanted, you'll let me know, please.
Thank you, Barbara.
Anything else, Vanessa?
Nope, I think that's all we got for
at the moment. Okay, let's talk about how good is self-care. And I'm talking about sort of the general population, and I'm talking worldwide. So I mentioned in my disclosure slide that I have developed a lot of instruments to measure self-care, and I give them away for free. I also I give them away for free, and I help people translate them into other languages. And so this is our oldest self-care instrument, the Self-Care of Heart Failure Index. And this is just kind of a picture of what the beginning of it looks like. It's separated theoretically into self-care maintenance, monitoring, and management. All of these separate scores are standardized 0 to 100. We consider a score of 70 or above adequate or good self-care. So it's been translated into, last time I looked, 24 different languages. And so in 2021, this person did a systematic review of studies of heart failure self-care from 39 different countries, almost 9,000 patients. And what she found on average of all these 39 studies in these essentially 9,000 patients was that self-care was inadequate. And so these scores can be interpreted easily because the scores are standardized 0 to 100. Think of you getting a score of 58 on an exam. Not too good. And that was a score on the self-care maintenance scale. On the self-care management scale, the score on average was 53 out of 100. Not good. There was also a measure of self-care confidence, and that was not great either. So that was, 59 out of 100. So we do know a lot about heart failure self-care, and it's not a pretty picture worldwide. So when self-care management is poor, and I'm going back to people with heart failure because this is the chronic illness that I work in the most. What we find is that there are differences based on symptom response. So in this figure, this is a scale of 0 to 100, basically. And these are scores on the self-care heart failure index self-care management scale. And this is time on this part of the figure is time across the bottom, time in months. And what we find is that people who are really good in responding to their symptoms, so they know they have a symptom and then they do something about it. Maybe that do something is take a medication, maybe it's call the doctor, but they don't just ignore it. They monitor for it and then they do something about it. And if you look at these people over time, they are less likely to die, go to the emergency room, or be hospitalized over a 12-month period of time. There are other people who are pretty good in the self care maintenance behaviors. So these people might be taking their medications pretty routinely. That's a self care maintenance behavior. But when they get symptoms, they're not doing anything much about it. And these people are a bit more likely to go into the hospital, die, be admitted to the emergency department. But look at these people. These people are really poor in self care management. They have a poor symptom response. And starting like pretty quickly in this 12-month cycle, these are people who are much more likely to die, go into the hospital, be admitted to the emergency department over a 12-month period of time. So it's this self-care management process is really important, especially in people with heart failure. So underlying this self-care process is the need for reflection and decision making. So I want to say a few things about this. We Early on, we thought that self care was a rational process involving purposeful choices and behaviors. And it's not. That was totally a, a dumb assumption on my part. But what we've learned is we look at some of this work from Kahneman on decision making, wonderful book, Thinking Fast and Slow. He talks about two different ways that people make decisions. They make decisions fast. These are, think of yourself driving a car. These are fast decisions, they're subconscious, they're automatic, they're everyday decisions. They're error prone. Then there are slow decisions. They're conscious, they're effortful, they're complex decisions. I would suggest to you that there's a third kind of decision making, and this is the kind of thing that we see a lot with self care. And this is when situations are stressful. These are real world decisions that are evolving dynamically. They're uncertain, they're ambiguous, they're missing some information. There's time stress, there's high stakes. This is what I think captures the symptom response really well. If someone develops an acute symptom, oftentimes they don't really know what's going on. They're uncertain. The situation is ambiguous. They really aren't too sure what they should do. And so naturalistic decision making captures this very well. So I'm going to stop for a second and give you a polling question. Please think about a decision that you made in the last day. What was it? Did you make a fast automatic decision? Did you make a slow and careful decision? Or did you make a hurried situation specific, stressful situation was stressful, and so you made a hurried decision? Please respond.
Looks like we've got about 50% responded so far. So I'll keep watching it for another few seconds. So it looks like we've got close 70% have responded, and we've got about 57% said slow and careful, 24% fast and automatic, and 19% hurried. And then we've got a couple people in the chat saying slow and careful too.
That is, I love that. That is really different than most of the responses that I get from people. I usually get fast and automatic. So I think that's very cool that you're making slow and careful. Did anybody explain that, Vanessa?
Not in the chat. Nope. But We can, if you want to explain your answers, please put those in the chat. I'll monitor that.
Let's come back to it, because that is really, really surprising and very, very cool. Must say something about Oregon. I don't know.
And this great group that keep listening to our Addis Medicine series. So.
That's very cool. Very, very cool. Congratulations. That's actually the best. That is absolutely the best. Okay, so I want to talk a little bit about reflection. And for those of you who are healthcare providers, I think you're gonna say that you see this in your patient population. What we want to see ideally is someone who is reflective and good in self-care. That's what we really want to see. But the reality is that it's not uncommon, excuse that double negative, to see unreflective but pretty good self-care. This is, I always think about someone who's really good about taking their medicines, but they don't think about it. They don't know what the medicines are for. They just do it because my doctor told me to do it. Then there are people who are reflective, but they're not engaging in self-care. And I always feel like the person that comes to my mind when I think of this particular quadrant is someone who might smoke, and they might be thinking like, I know this isn't healthy, but I'm not ready to make a change. So they're reflective, but they're not doing it yet. And then there are the group of people that we probably all encountered who are not thinking about it, and they're not doing it, and they really don't have a whole lot of interest in doing it. So reflection becomes a really important part of this whole process, because if we can get people to be thinking about self-care, chances are they may well be choosing some self-care behaviors, and there are many to choose from. So I want to talk a little bit about whether or not self-care interventions improve outcomes. And I want to tell you a story of two separate meta-analyses. Let me first explain what a meta-analysis is. So this is when someone takes a lot of published studies, usually randomized controlled trials, and they put them all together and reanalyze all of those studies as one. So it's a reanalysis of a large group of studies, and that's a meta-analysis. So let me first begin with what is a self-care intervention. So what I look at in a self-care intervention is those things that people do that focus on changing behavior by equipping patients with the knowledge and skills they need to actively engage in and take responsibility for self-care maintenance, monitoring, and management of their illness. So ideally, it would improve behavior, encourage independent monitoring, and problem solving and decision making. That would be like a really cool self-care intervention. What we see in the literature is a lot of interventions that only focus on one particular self-care maintenance behavior, weight reduction, something like that. Or interventions in which the patient monitors and then they give the information to the healthcare provider who tells them what to do with it. Or interventions where the patient is just told what to do and when to do it by the providers. These are not self-care interventions. So in this story of two meta-analyses, we started with one where we did a scoping review, and what's key to this list is that these were interventions where and there's a 2 here because we chose interventions that had maintenance and monitoring or monitoring and management, but they didn't have to have all 3. So they had 2 of the 3 core behaviors. We looked at trials published over a significant portion of time, almost 60,000 patients. And we had some answers that I'll show you in the next slide. But the more recent one that this meta-analysis is under review, where these were comprehensive interventions that had elements of maintenance, monitoring, and management. And so I want to show you the data from 2 elements of self-care versus 3 elements of self-care. So when we looked at only 2 elements of self-care, this particular figure is a typical meta-analysis figure. And so let me just sort of walk you through it. This is basically, this red line means no effect. And over here, if you went to the left of it, this would be a negative impact of the intervention. And if you go to the right of it, it's a positive impact from the intervention. That's good. We're seeing everything's over on the right-hand side. And these are confidence intervals that are shown here. And this dotted line is the average of all these different of the meta-analysis results for all these different conditions: asthma, coronary artery disease, obstructive pulmonary disease, diabetes, heart failure, etc. And so and then the last piece I want to give you is that actually the results of a meta-analysis are pretty easy to interpret because they're small, moderate, and large. Cool, that was simple. So you can see that this is pretty close to the small effect size, and meaning that we don't get a huge benefit of these self-care interventions if you have only maintenance and monitoring or monitoring and management. But if you go over to this one where you have the same sort of a figure, this is the earlier meta-analysis that I just showed you. And then this is the more recent meta-analysis where we had all 3 elements in one. And you can see that the effect of those kinds of interventions, here's what you need to be looking at right here, is that this went up to a moderate effect size. And these arrows showed you that when you have all 3 elements in one intervention, maintenance, monitoring, and management, that the effect on outcomes goes up overall goes up for high blood pressure, for heart failure, for diabetes, for chronic obstructive pulmonary disease, and for asthma. And I have no idea why it went down for coronary heart disease. Okay, so last few slides here. What can you do? So the first thing I would say to you, and this is whether you're a layperson, a healthcare provider, if you're a human being, find an exercise that you like and do it. The second thing that you can do is prioritize sleep. And there are a lot of different apps and toys and approaches other than sleeping pills. That's not what I'm talking about. Stress reduction in preparation for sleep, whatever it is, make sleep a priority. The third thing that I have on this list is to recognize the complexity of self-care. If you're a healthcare provider, ask your patients what they do for maintenance, for monitoring, and for management, because I've just shown you some data that I hope is convincing that those individuals and those interventions that look at all 3 of these mechanisms together actually have the best outcome. Another thing that you can do is to recognize and think about interoception, the ability to recognize what's going on inside one's body. And so this is a potent influence on symptom recognition and response. You want to explore the awareness of patients to their symptoms and their bodily changes, and recognizing that it's not just a heart failure patient who comes into the emergency department and hasn't recognized that he gained 20 pounds. And you think, don't think to yourself, like, what's the matter with him? Think to yourself, oh, this is a problem with the insular cortex. So I need to help that patient go beyond to recognize and bodily changes and to come up with some tricks that will help that person actually become aware of bodily changes. Another thing you can do is focus teaching on situational skills, what to do when, and encourage patients to think about how well something worked if they do a self care intervention to encourage repetition and improvement. And I think that's my last slide, basically. Do you have questions? And I'm just going to stop sharing and talk.
Great. I'm going to go through the comments here. Lots of thank yous. Thank you so much. This has been very wonderful. This is so great. Sorry I have to leave early to go take care of a patient. Everything counts. If you can't exercise for 60 minutes, you can still take a walk for 10. Whatever you can do adds up.
Yes. I agree.
Person, just mostly comments, not many questions, but if people have questions, please put them in the chat. Some people talked about planning and decision making. So one person said, when I planned for lunch today, I thought about what I could bring that would be healthy and allow me to eat while watching webinar. So that was an example of some slower decision making.
Beautiful. Love it.
Let's see.
Another heart person in there. I saw that comment. Yeah.
And then I'm not seeing any other questions. I am seeing, thank you for tying to movement and exercise and sleep. And this is just another plug for our Lunch and Learn series. So I think we told you, Barbara, that, shared that we had our last Lunch and Learn was sleep and sunshine as medicine. And then we have one coming up in June, which we have not announced yet, but it's going to be, as far as dates yet, but it's going to be movement as medicine, and it's going to be specifically looking at those cognitive and brain functions and how they're improved with exercise and movement.
Oh, love it. This is such a fabulous series because for years I've been trying to counteract the bubble bath perspective. And oftentimes I'm asked to speak on self care. And then when I explore a little bit further, I realize they want me to talk about bubble baths and self soothing. And I said, no, that's not what I do. I really, it's the self care as medicine really captures well the way I look at this whole process.
Great. One question or something that I would like you to maybe comment on is one of the things that we know in rural areas, which Douglas County is mostly rural, is that we often have a delayed time period. So if you're having a cardiac event, for instance, the first 20 or 30 minutes is really important. And sometimes we don't have access to medical facilities in that short period of time. So can you talk about how that, particularly interception, can play into understanding what's happening before it gets really bad, or
Yeah.
can you talk about some research on that?
I think, Vanessa, that you really captured exactly the issue right there. And that is that if someone, for people who have a chronic illness, they need to be particularly good at monitoring and really paying attention to what's going on in their body because they might not have a whole lot of warning of what's going on. But then when we look also at teaching people about the what to do when kind of things that it would probably behoove the practitioners in the rural areas to say, to prepare people for, and if you get chest pain, do this, handle it this way, have a go bag, ready, all of those kinds of things, but sort of talking through the monitoring and the management elements of self-care in a rural community, particularly important.
Okay, thank you. We do have another question. Do you think apps and equipment like Fitbits are helpful to self-monitor and take action?
I definitely do. In fact, I wore my Fitbit until just recently, and then I thought to myself, well, every once in a while I just sort of take it off for a while because I get to the point that I don't pay any attention to it. So that's why I don't have my Fitbit on right now. But whatever it takes to get you and your patients paying attention to their body and building habits, because that's what a Fitbit does. It helps you build a habit. So yeah, I think apps and devices are very, very helpful.
Great. We have another question. While we can all be part of the solution, what's the best way to help people and patients gain these skills? Doctors' offices, community presentations. What are your suggestions for that?
That's it's a great question. I mean, the days have changed. The time has changed from the days when we actually had time to really sit down and talk to patients. I'm not a great fan of bibliotherapy, of just handing somebody a brochure and saying this is the way to do it. But there are a lot of really innovative things that you can find on the internet, where people are, even in clinics, pulling people uh, uh, in chat rooms to do discussions about self-care behaviors and other things. There's also video yoga and all sorts of other things that we can do, and we can make the best use of the internet. So I think there are a lot of options, but it certainly is not the one-on-one patient teaching that we used to see back in the old days.
Great. Thank you. I'm not seeing any other questions. Give maybe people one more minute to put some additional questions in, and then I'll wrap up and share about resources and our upcoming lunch and learns. Great. I'm not seeing any other questions. So just as a reminder, we'll send out our post attendee survey. It just has 4 questions on it. Just let us know if you have additional topic ideas, what you thought, what your takeaways were from this great webinar. Our next one is going to be Nature as Medicine, and that's going to be on Earth Day. So that's the 22nd of April. And then we're also looking at the Food as Medicine Part 2 with Erin Fredericks and bringing her back in May. And then we're also planning some other ones in the works. So watch for the links for the registration for those. We also just recently added a page on our website that has the upcoming Lunch and Learn. So we'll get that out to everybody. Oh, it looks like one person just has a comment. Some physicians write prescriptions for exercise, etc. So
Yeah, I'd love to comment on that, because that is such a great idea. I don't think it's actually going to help it be reimbursed by insurance, although in some situations it might. But it does give it the authority of, I really am supposed to do this. This isn't just extra. This is really a health behavior. So I love it when docs do that.
great. Well, thank you so much, Barbara, and we're grateful for your time and your expertise and sharing your great research and body of work with us today. So
Thanks. Thanks for having me, Vanessa. I enjoyed it.
absolutely, we did too. Thank you, everyone.
All right. Bye.